Hello, I'm Sophie Scott. Welcome to Health Watch. This week we're going to look at the interaction between the mind and the body. You've probably heard about the placebo effect. Thanks to some new Australian research, we now know a little more about how it works. A study found that giving patients a placebo or sugar pill could lead to significant improvements in their health. And it happens even when they know they're getting the real thing.
A little sore, but not
Gary Wade suffers severe lower back pain, so bad he ended up in Sydney's Royal North Shore Pain Clinic. But the injections he's getting may be little more than a placebo.
We'll see at the end of the day which one works, and if the whole thing works, terrific. So if it minimises my pain, that's wonderful.
Australian researchers have uncovered new insights into how the placebo effect works. It happens when patients feel better, even when they're given a fake treatment.
The core placebo is about the mind-brain interaction, so we know there's lots of psychological components to therapy. That's patients' beliefs, expectations, desire for improvement in their symptoms.
Researchers found it's not what's in the sugar pill or fake injection that makes patients feel healthier, but it's the act itself of receiving treatment that switches on the brain to heal. And they found patients don't even need to get a placebo for the benefits to occur.
It's about using our routine therapy, but realising there's another component to what we do, and we have these mechanisms, internal healing mechanisms, so to speak, that we can harness and activate to improve our current therapies.
One of the biggest concerns about placebos has been the ethics of withholding treatment without the patient's knowledge. The new research shows that the placebo effect works even if patients know what they're getting isn't the real thing.
We need to be more adept at using placebo as a part of the treatment that we provide, because placebo has very few adverse effects.
As for Gary Wade, he's happy either way, just as long as he feels better. Tens, if not hundreds of thousands of Australians swear by homeopathic treatments, and their health funds pay for them. But are they all being hoodwinked? A British parliamentary report has labelled homeopathy as scientifically implausible, but that's a conclusion being strongly challenged by Australian homeopaths. Homeopathy is a natural therapy where an active ingredient is diluted again and again until there's very little of the original substance left. It's widely used in Australia, despite a lack of definitive clinical evidence that it works. Now a report from a British parliamentary panel says it's scientifically implausible and works no better than a placebo. The Science and Technology Committee says homeopathic products are not medicines and should no longer be licensed by the publicly funded National Health Service.
And so this is a fundamental point of principle as to whether, in fact, we are actually hoodwinking individual patients, that we're being given a treatment which the NHS knows does not work.
Australian homeopaths say the committee was biased and only considered one kind of scientific evidence.
They also disregarded a lot of the studies that have been done where homeopathy came out very well, including studies of thousands of people in hospitals.
In Australia, homeopathy isn't covered on Medicare, but most health funds reimburse their members for visits to registered homeopathic practitioners.
You need to be registered with ARO, the Australian Register of Homeopaths, and because not only does that show that you've met the government-endorsed competency standards, but also that you have the adequate indemnity insurance and that you have up-to-date first aid and all those other requirements.
The health insurance industry says it will continue to support homeopathy, and it's up to individual funds to decide which treatments they fund. Also this week, Australian researchers have uncovered new evidence that paracetamol might protect against heart disease. They've found that it switches off an enzyme which raises your risk of a heart attack. It's early days for the research, but it could be that the humble pain reliever might do more than stop headaches. That's all for Health Watch. See you next week.